Hello and welcome back. I am Ashok Rajguru, your instructor. This is the last video in our module and we will be taking a look at supportive treatments or therapies. Now some will argue that these are strictly not homeopathic, but if we look at aphorism 291 of the Organon, Hahnemann himself talks about warm baths and cold baths and massage, which may be only palliative, but which can bring forth physically beneficial alterations to the sick body. So in that context, please keep your mind open to use these therapies in order to assist your patients to recover faster. Earlier in the module, we had seen that the use of nasal decongestants is very rampant and it is having many perils. For example, a lot of these substances are actually addictive. People need to use them constantly and more frequently. We also saw what rebound congestion means. Rebound congestion is not only common, it is in fact one of the principal side effects and actions of each of these nasal decongestants. People report even stronger symptoms coming more frequently as they use these nasal decongestants more frequently. So they end up requiring more frequent and larger doses. I will encourage you to please read up the paper published in the American Association of Family Physicians, the November 15, 2009, volume 80, number 10, where it has published a study and review of two studies which point to the fact that there is a consistent, good quality, patient-oriented evidence that nasal irrigation is an effective adjunctive therapy for common symptoms of chronic rhinosinusitis. That's very encouraging because we can recommend our patients in our care who are under homeopathic treatment, because this is also going to be a palliative and it will increase the comfort level of the patient and discourage them from going towards finding an allopathic nasal decongestant, which can have deleterious effects on their health in other parts of the body. And as Hahnemann mentions in the 6th edition of the Organon, aphorism 291, it is always better to have some palliative therapies like cold baths and hot baths if it helps the patient to relieve his symptoms and adds to his level of comfort. Now, nasal irrigation is one therapy which can help our patients considerably. It's an ancient yoga technique which has been used for many centuries, and it has evoked a lot of interest from the medical community all around the world. A recent review, which has been referred below, reviewed or examined 8 very high quality studies, and it concluded that salt water irrigations are very helpful to patients who are suffering those conditions that have been discussed in this module. Essentially, what the person does is to rinse the nasal cavity, that is the area behind the nose, with salt water or saline. It can be done at home, and it will help a person with sinus problems and stuffy or runny noses. Nasal irrigation is usually done with a pot which is known as a neti pot or a neti pot. This particular word neti comes from the yogic tradition. Neti pots can be made from plastic material or from ceramic material, or they can also be made of metal. A lot of people in India use the metal version. In the West, the ceramic ones and the plastic ones are also quite popular. Essentially, nasal irrigation is performed by instilling salt water in one nostril and tilting your head in such a way that it allows the water to drain out of the other nostril. In this way, it bathes the entire nasal cavity with salt water. Saltwater nasal irrigation can be performed with low positive pressure. In other words, it could be a squeezy bottle which you can squeeze, or more commonly, it is gravity based. In other words, the pot is held in the hand as shown in this picture, and the head is tilted so that the water flows out under the force of gravity. This graphic illustrates this particular feature. In this module, you will find a link to a video which shows this particular practice. I do it very frequently, even if I'm not having a cold or suffering from a nasal congestion, because it is part of my yoga practice. Now, here are some precautions which you must know and which you must educate your patients. The delivery device or the pot which is used for nasal irrigation must be clean and sterile. That is very important. One study found that almost 1/3 of the irrigation bottles used by people were found to be contaminated with bacteria. Bottles can contaminate the nose if they are not cleaned properly. Therefore, the suggested sterilization methods are cold water irrigation of the pot, that is, washing them thoroughly, or using boiling water to rinse them, or using a detergent. Some people even recommend using an antibacterial solution, or microwaving for 2 minutes with cold water. The water source that is used for filling the pot is also very important. It must be ensured that the water source is not carrying any germs or bacteria. There have been 2 reports in which 2 patients died from exposure to an amoeba that was common in rivers and lakes. Of course, you must understand that these are very rare occurrences, and so far in the last 5 years, only 2 fatalities have been observed or recorded. However, appropriate caution should be used when selecting a water source for irrigation, and boiled, distilled, or appropriately filtered water are recommended. You can have a look at this resource which has more information on this subject. Now, if we turn to the benefits of nasal irrigation, there are many, and these have been recorded in a large number of scientific studies. Principally, people have reported improved quality of life, less frequent symptoms. Patients feel empowered. They feel empowered in their own self-care, and they feel less dependent on the physician. I shall now summarize the points that were discussed in this video. We talked about supportive therapies, and we understand that many supportive therapies may be only palliative. However, they do add to the comfort of the patient, and the benefits includes a sense of feeling better, fewer visits to the doctor, and lesser medication. It makes the patients feel empowered that they are in a position to take care of themselves, and that itself is a very big benefit. Also, we talked about the precautions relating to contamination and the chances of carrying infection from the nose to the water pot or from the water to the nose. So thank you very much for your attention, and bye-bye.